Have you ever wondered why some facilities just won't budge when it comes to working with staffing agencies? Well, in today's video, I'm going to unveil the secrets behind their hard no and give you a better understanding of the decision maker's mindset. In this video, I'll share invaluable insights that most people in the industry keep to themselves. Drawing from my first-hand experiences as the owner of a home care agency and medical staffing agency, I've been on both sides of the negotiation table. I know what it takes to navigate the complex dynamics between facilities and agencies, and I'm ready to pass on that knowledge to you. By watching this video, you'll discover how to position your agency in a way that aligns with the long-term objectives of the facilities that you're pitching. Understanding the logic behind their resistance will empower you to present offers that make sense to a company that is historically anti-agency or trying to get agencies out of the building. Trust me, this is the kind of useful information that a few are willing to share. Let's get into it. Well, the first thing I want to talk about is company culture and fit. Building a successful partnership with a facility goes beyond just providing staffing solutions. It's about understanding their unique company culture and finding the right employees that can fit right in. It's important to align your agency's values, mission, and work culture with that of the facilities that you're pitching. If you've never worked for a staffing agency before, it's really important for me to kind of explain the dynamics of working in a facility as a staffing agency nurse. The issue is that there's usually a rift between the agency workers and the incumbent staff, and it usually revolves around rate. Oftentimes, it's rumored that the agency staff are getting paid much more than the facility staff, or the facility staff has lost their overtime privileges and that has been mapped to the agencies because it might be a little more affordable or just something that the facility decided to do. So usually when these new bodies come into the facility, the incumbent nurses are a little hands-off or resistant to their presence. They don't teach them the protocols, they don't share any information with them, and it creates this hostile environment. And anybody who has worked in agencies or has managed a facility that uses agencies and is now running a facility that doesn't work with agencies may not want to bring that element of agency incumbent rivalry within their facility. Also, when people work for and train for a facility, they learn all those things up front. During their onboarding, during their initial orientation, they learn about the systems. They're usually paired up with a nurse and brought along. The benefit of that is that they really understand how that facility works. And it's almost impossible, unless there's really good training systems in place, to have an agency nurse hit the floor and fit right in. So to not disrupt that dynamic that has already been established and to keep quality of care at kind of a premium, a lot of facilities may shy away from working with agencies. Now, what happens if that same facility is really understaffed? Is it patient care going to be sacrificed? The answer is yes. But if the top opinion and if the mindset of leadership is, we need to keep the team tight, we don't want any strangers in the building, these people kind of come and go, they're drifters, they really don't care about the patients. If that's the mindset at the top, they're going to want to try to conserve that mission, vision, core values of the organization in their hired staff. It's kind of hard to expect that people who are just coming in for a few weeks or even just day coverage to fit right in and get it. So that's usually one of the reasons why facilities kind of shy away from working with agencies. They don't want to disrupt things. It's not in their culture to begin with, and they don't really have good systems to onboard those agency workers the way that they do their incumbent staff. So you always have to kind of go into your negotiations understanding this and be able to speak to that point. If you find a facility that doesn't use agencies, but is open to talking to you about this dynamic, you can try to work with them and say, look, I understand that you don't want to have this rivalry between staff. You want to make sure all the staff are well educated. How about we develop a training program or an onboarding program that's similar to your facility's onboarding program, so there isn't a difference between our staff and your staff. We could pre-record sessions, we could have those sessions done in-house at our cost, or even pay to have these sessions done with our staff so that they fit right in and hit the ground running. The next thing to consider is their budget. Money matters. Facilities are always mindful of their budgets, and understanding their financial constraints is crucial to winning their trust. Usually when facilities are working with agencies, they're working with agencies because they're extremely short-staffed. There's either a crisis scenario, strike, pandemic, something along those lines that kind of push them to a situation where they don't have enough of their own internal staff and they have to start reaching out to staffing agencies. And when that happens, it puts them in a weird position where they're willing to pay up to get nurses, or other qualified staff in the building. Now, this is a problem because the chief financial officer, the CEO, the board, they've designed a budget for the year, and they're expecting a certain amount of services to be conducted by the facility and a certain amount of money to be managed in personnel. If the staffing agency is blowing their budget out of the water, causing their staffing costs to be raised by 30, 50, even 100%, it's not really sustainable. So agencies usually come in at a higher price than what it costs them to hire internally. And because of that, it's always going to be a line item on the budget that has to be shrunken down, that has to be brought down, or else the facilities cannot thrive. Most healthcare operators aren't really operating at a very high margin. Medicare cuts are always getting slashed, Medicaid pays like crap, and if they're not doing enough procedures, or if it's a nursing facility where they're kind of on a fixed budget per bed, they can't tolerate staffing costs going up 30%, 50%. It's just not realistic. Staff is going to be one of their top expenses, and to have that line item go up 30, 50, 100% cannot be sustained for a long period of time. So if they use agencies during those crisis periods, they're going to see that line item go up, and everybody's attention is going to be on bringing that down. So what can you do to manage this particular problem? Commonly, especially right now, you have a lot of facilities who never use agencies and got crushed completely by using agencies, starting to try to get agencies out of the building. The thing that you can do with them is really try to understand, try to meet with their financial team and understand what is their true cost to employ somebody. I'm talking about their fully loaded cost. That's the employee's base rate, all the taxes that are included. So that's workers' compensation, unemployment taxes, the federal tax contributions, Medicare, etc. All those things add to their costs. They also are paying for benefits such as paid time off, sick time, holiday time. They're paying into sometimes education funds for their staff's children, into the union fees. So there's a lot of fees associated with employing somebody above their base cost. But if you could meet with the financial team to determine what is that number, let's just say that it's $70 an hour for an RN. Then as the agency, you could come in and at least say, hey, look, I'm willing to negotiate with you. If you're able to pay your staff and turn a profit, but still keep it at their budgeted true cost to employ, then you're going to be golden. So a lot of times the people who are making the decision, sometimes it's the administrator, sometimes it's the nursing director, they actually don't know the true cost to employ. So when they see $70 an hour on your billing table and the nurses in that facility are getting paid $45 an hour, they may say, whoa, this seems like out of line, etc. Even if you were to look at the overtime cost, let's just say you have an overtime employee who's getting paid $45 and time and a half is going to take them up to about $67, $68 an hour, right? If that's the case, then you're at least going to be in line with their overtime rate, which they're paying anyway. But if you could really get yourself aligned to their true cost of employment, because as the agency, you're not charging them taxes or anything along those lines, it's still your responsibility when you pay. But if you're able to keep it in line with their budget item, plus enough to make money for yourself, then you're not going to be in a situation where they're cutting you, because that's what they budgeted for anyway. If you find this information helpful, please do me a favor and hit that like button, as well as subscribe to the channel. On this channel, our goal is to help people like you start, grow, and successfully sell their companies. So please and thank you. Another thing anti-agency facilities are concerned with is the management of personnel. Efficient personnel management, scheduling, and record keeping are vital components of any successful staffing agency. A big piece of running a healthcare organization is employee record maintenance. Personnel records are something that are scrutinized by the accreditation bodies, by the state, by whoever is governing that facility. It's going to include whether or not there was a full application on file, are the employees' records up to date, is their driver license up to date, are they on unemployment authorization, and if they are on employment authorization, is it still valid so that they could work within the country? Are their physicals up to date and dated within the past year? Their TB, their titers, all of these mandatories need to be in line. Are they up to date with their in-services? All of these things are the primary responsibility of the facility. And if they're working with an agency, they're now sharing that responsibility with the agency. So if the agency isn't keeping up with all their records and maintaining compliance to the same level as the state, they can be in for a crazy surprise. Let's just say that you've had agency workers in the building for 6-7 months. Now, when that nurse came in, all of their files were up to date because the agency reviewed them, sent them in, the facility checked them out, made sure that they were compliant, but there's no communication or system in place between the agency and the facility. And some of those files have now expired because driver's license lapsed or the physical has lapsed, whatever it is. But then JACO walks into the building or the state walks into the building and starts to pull personnel records. What's going to happen is they're going to stumble upon these records that are expired, out of date, and ultimately the facility is going to get dinged. Facilities that have been through this will also shy away from agencies. So when you are negotiating with a facility and they're concerned about the personnel record side of things, how you maintain the schedules, what is going to be the correspondence between your agency and their facility, you need to make sure that you have that conversation and say, hey, we understand what are your compliance needs, especially when it comes to your personnel records. And here are the systems that we have in place to ensure that nobody is sent to your building that's out of compliance. And in fact, we continue to track them, even if they're with your facility for years or months, to make sure that all those records are updated. In fact, can we meet with your HR manager to make sure that our compliance systems are aligned and that we're able to communicate with each other and share information so that we can keep the records to the same standard as your facility does. By getting ahead in the conversation that way, it shows them that you're truly aligned with the responsibilities that facility carries, and ultimately that you're part of their team. You're supplementing their staff. You're supplementing exactly what they need to do to stay afloat. So you always want to show that you're aligned with them, that you understand what's going on in their facilities. And it's not just this money grab where you're like, hey, I have staff, you're desperate, I'm going to make all the money and your facility is going to suffer. No, you guys have to be aligned, because if you're not aligned, you're either going to get cut as the agency or that facility is going to suffer when it comes around to audit time or it comes around to just kind of financial overhauls. If they cannot afford to stay open, they sell or they close. And then that's going to be the end of your contract. So you have to always kind of stay on top of these three factors, because if you do, then you know that, hey, we are fully aligned. We're not too expensive. We're on top of our records, and we're making sure that our staff understand the culture of that facility. Thank you for joining me today as we explored the real reasons behind facilities' hesitations towards staffing agencies. If you found this information valuable, I invite you to take it one step further. Join our monthly group mentoring program where we deep dive into these topics and provide personalized guidance for your agency's success. Visit our website now to learn more about our mentoring program and gain access to exclusive webinars, including our latest on how to calculate your billing rates. These sessions offer invaluable insights and practical tips that can elevate your agency's performance in the competitive healthcare staffing industry. Don't miss out on this opportunity to really propel your agency towards new heights and push it forward. Visit our website today and sign up for our monthly group mentoring program, and I'll see you in the next one.